Well, tell me your name and your title here.
My name is Bob Frein, and my official title is Director of the Bureau of Subsidized Childcare Services, which is located in the Office of Child Development and Early Learning, which is a mouthful.
That's like the Chinese bureaucracy.
Yes, it is.
The imperial this or whatever, yeah. I've studied Chinese, that's why I was curious. So how long have you been at this, Bob?
I've been working at this for almost 9 years in October. I started out as a special assistant in the Office of Income Maintenance and slowly helped set up the office. It had not been set up before, and was one of the chief architects of helping set up the Office of Child Development, which eventually became the Office of Child Development and Early Learning, so that we could try to integrate all of the early childhood programs together in one office.
I see. One stop for early childhood.
Correct.
And we're in Pennsylvania, if we didn't mention that, I forget.
Yep.
So it's not the same in every state, but it probably is a little bit, right?
A little different, although I think we're unique in the fact that we've integrated our children's programs and try to have a seamless program for basically kids from 0 through 13. And we're a dual office, so we report to the Department of Public Welfare as well as the Department of Education. So actually, Pennsylvania is unique in comparison to most states, but states like Virginia and other states are starting to follow this model because they realize it's important to have the programs work very closely together, and it's a lot more seamless to be able to provide a continuity of services for young children rather than to have silos and bifurcate how they're set up.
Well, what I want to do is educate people about what's available for children. So if we could do that in a shortened form and maybe list the kinds of things that people may be able to avail themselves to or who's eligible and things like that. So what are the basic programs you have?
Well, the basic programs, I mean, in our office, we've got basically four bureaus. We have a Bureau of Certification, which basically license child care providers. So in Pennsylvania, you're licensed if you're a center, which basically has more than 11 children. You can have a group home, which is basically 7 to 11, and a family daycare home, which basically has 4 to 6 children.
So you license all those daycare providers, right?
Correct.
So how would a consumer use the information, or is that available to people? Or
yes, we have all kinds of information available. So those are the centers through licensing, and we actually have online applications. We have an online provider search. We have regional offices. We make a real effort to educate parents as to what their early care and education options are that are available, and not just centers and family daycare homes, but we have a quality rating system with stars 1 through 4. So we have information on the DPW website. We have information on the Department of Education website. Our local grantees advertise it. You can apply for services online through the online application through Compass. So we really try to saturate the market with all kinds of information so that parents know where to go to find quality child care, and we make a real effort to educate them on the importance of quality.
So you're a place for, say, a mom that has a 3-year-old at home, and what do I do? That you could go into your portal kind of thing and evaluate services and find out what's available.
That's correct. If you
want to rate it, they're rated too, like smiles or what?
They're rated with stars. So our quality rating system is called Keystone Stars after the Keystone State, and there's different levels. So you can be star 1 through star 4, with the highest being star 4. And actually, if you go in as a parent into the portal, you can just type in your county or your zip code, what you're looking for, infant, toddler, preschool, whether you want a star facility or not, and it will bring up the child care centers or family daycare homes or group homes based upon the criteria you set that are closest to work or closest to home. That will be based upon your age group. You can also contact, and what we have is we have 59 child care information services agencies, which are the
child care information service agencies?
Correct, and they do the eligibility and provider payment and take care of all the programs for low-income families, but also for families that are just looking for child care. And so they have offices, and they do the eligibility for...
So there's 57 around the state.
59 of those around the state, and they have...
You can turn to them, and they evaluate what you need and help you find it.
Correct. They will...
No matter what income.
No matter what income. Their primary responsibility is to take care of TANF and low-income families that are eligible for the subsidized child care program, but they have a very robust parent counseling and resource and referral function where if anybody contacts, they know all the providers in the community. They'll tell parents what's available. They've got literature on those programs, but they also have literature on our Quality Pre-K Counts program on Head Start.
Quality, what was that?
PA Pre-K Counts program, which is a high-quality program for preschool children, which is an innovative program that Pennsylvania has. We have information on Head Start if families are eligible for Head Start, as well as all kinds of other social service programs. So what we try to do is kind of be like a door to whatever services any family needs and be able to provide that information for them.
Now, it's really for children and pre-K children, is that it? Or what?
Well, we're basically taking care of children from 0 to 13. So, I mean, so there's infants, toddlers, preschoolers, and school-age children. A lot of children need before and after school care. Providers provide transportation. So we're providing care for a full range of children and whatever their needs are.
So if you have a child in 4th grade or something like that, then what kinds of things would be available for somebody like that?
Well, there's a big need for care for school-age children because there's a need for before and after school. So a lot of parents work, so they'll drop off and they'll get breakfast at the child care center. The child care center may bus them to the school because parents working. We'll bus them from the school back to the child care center. Also a great need for the kids to have a place to stay when school's out because there's a lot of vacation days. And so it's a good place.
Mom doesn't get a vacation.
It's always better for kids rather than to be home alone or be latchkey kids to actually be in a quality program that involves socialization. Sometimes it involves helping them with their homework. And so there's a lot of great before and after school programs. Stuff. Yes, they do all kinds of different things.
So in other words, if you have a child 13 and under, you should check out this portal.
You should, and it's a great portal. It's got all kinds of information and information on all kinds of early childhood programs and what those programs mean, and so that a parent who has information can pick something that meets their needs.
And when you say the income eligibility, so there's some programs that there are subsidies for and others that aren't.
That is correct.
And generally, I mean, I get confused on what low income is anymore.
It depends on how you would define that. For example, if you're on a family that's on TANF for cash assistance and you're an approved work or training activity, you're automatically eligible for a child care program. And so that's based upon...
That's a temporary TANF, temporary assistance for families. Correct.
For Head Start, their eligibility requirement is 100% of the federal poverty income guidelines. And for our program that is not TANF or Head Start, but is former TANF or low income, our eligibility requirements are that you have to be below 200% of the federal poverty income guidelines to be eligible, and then you lose eligibility when you go above 235% of the federal poverty income guidelines. So in other words,
if you're below 200%, you get in. You can't get in over 200%, but you can get in under 200%, and you can stay until you're 235.
Until you're above 235, correct? Because we have limited dollars, and we're trying to help those that need the funding the most.
For a family of 4, what is that nowadays?
Family of 4 would roughly be about 46,000. It used to be 44 something, but the new federal poverty income guidelines came out, so I'm going to say it's somewhere about $46,000 a year. And the cost of child care for full-time care is very expensive, a lot more expensive than some universities.
Yes. No, I mean, I think it's just one of the biggest, probably the biggest issue in our country right now is, because if we don't take care of those people 13 and under, man, the rest doesn't matter.
And I think the research shows that brain development in the first 5 years, that it makes the biggest difference. One of the things I used to, that we say all the time is that a good early childhood educator will have more influence on the development of child than any grade school teacher, high school teacher, or even a university professor, because 90% of the brain development is really within those first 5 years. And so those early years are so important, but not everybody always realizes that. So it really is an important issue. And all the studies show that real quality early care and education, especially for poor families, saves money right now and pays dividends for the future.
As a society.
It's a great investment.
The individual. I think there's nothing better to invest in than the education of children, because the rest we could fight about, but that seems like a no-brainer. Yeah,
it is, but unfortunately sometimes
you can't convince everybody.
You can't convince everybody of that sometimes too.
Y'all got different priorities, I guess. So even if you have, like that 4th grader, I mean, I mean, would it be, because early childhood, if somebody not in school yet can understand almost any problem. But I'm thinking from 5 years old to 13, I mean, you have issues like maybe truant problems with the kid. I mean, it's a good portal to check with, or study habits, or counseling, or I mean.
Well, we have a variety of different programs. So let's just say, for example, a child is exhibiting some learning delays or something before they get to school. I mean, the center director may talk to somebody. We have a very close relationship in our bureau with the Bureau of Early Intervention. So if somebody's noticing a speech delay or physical delay or something.
Early intervention preschool or during school? I mean.
Well, there's two programs. There's two early intervention programs. One for 0 to 3. So obviously kids are not in school at that program, and then another program that's 3 to 5, and then the school districts will then handle after that. But so before kids get to school, if a parent or a provider notices child having a delay or maybe some type of developmental issue, and the parent wants services, those providers will have the parent contact the appropriate early intervention agency that's in the community, and will actually provide services either sometimes at home, but a lot of times at the child care center.
Wow.
And so there's a real connection. So what we're really trying to do is connect the dots and connect services for families so that you can find everything that you need, but also the people there will help you if you need other services or you need other help. Whether you need WIC, whether you need extra clothes, whether you need CHIP, which is the Children's Health Insurance, whether your child may need to be assessed. And so what they're trying to do is look at all of those different things and really provide a continuity or an array of services.
And the providers, I mean, for people who aren't used to dealing with bureaucracies, I understand a provider, it's not a government office you're going to, it's a professional that the government pays to provide the services. Is that
the Child Care Information Service agencies are grantees, so they're there, but they're very professional, and they're people that have been very committed to early care and education, and that's where you can come and get your eligibility and parent counseling and resource and referrals and all that. But then you have just the child care providers themselves, which are providing care for children, and many of them have degrees in early childhood education. They have training that's required. The people that are in the Keystone Stars Quality Program have much higher requirements than just being licensed, and so they very much are committed to the well-being and healthy development of children, and so they're working with parents. They're working with those children to have a curriculum.
All the people you have listed, those that have the stars are volunteered to take an extra to be accredited kind of thing.
Correct.
Or whatever.
Correct.
And the others that don't have the stars are just getting a license to operate.
Correct. And we encourage as many people to do.
What percentage have stars?
I think about 60% of providers have stars. It's one of the highest. We have the largest voluntary quality program in the country, and one of the oldest. It's 10 years old. And right now we have 50. And we have 53% of our lowest income kids in those star centers, which is which is a great accomplishment. So we really make an effort to promote quality care because we know it makes a difference, and we know it saves dollars both right now and in the long term. And more providers are joining the program each year, and each year we're getting more and more children into high quality settings because that's a priority. We want to have the most bang for our buck, and we want kids to have the best success in school. And we're starting to see that PSSA scores are going up. So when you invest in early childhood education, then you're going to save money in special education, in tutoring, in all kinds of different things down the line.
I guess that's the data I've read superficially over the years, is that the early childhood education was so good, but then when the kids go to regular school, it sort of drops off. They still need that stuff, and that's why the scores are not keeping going sometimes.
Well, it's funny. States that have shown that have invested in early care and education and have kids in high quality settings, states that have full day kindergarten, those kids do very well. And so in Pennsylvania, over the last 8 years, these scores have gone up in math and in each of the different great groups. Now, some people can say that's related to quality early care and education. Some people can say it's related to how well the schools are doing.
Or the director of ours.
Well, I think it's related to a variety of factors. I think it's related to the fact that now there's a lot more schools doing full day K.
I see.
There's a lot more kids in quality early care and education settings, and I think school districts have done an absolutely wonderful job at educating and trying to do the best they can. And I think the studies have shown, I mean, there's been national studies showing that, that you save for every dollar invested, you get $1.72 in return right now, but you save anywhere from $7 to $14 down the road. One of the things I tell people is it costs $36,000 a year to incarcerate somebody in a prison in Pennsylvania. $36,000. It costs $1 million a year to take care of a child who's a victim of shaken baby syndrome. So if we can educate parents and we can educate young children, there will be incredible savings and incredible payoffs down the line, and we'll have a much stronger workforce. We talk about what's the way to build the economy and what's the way to kind of have more tax dollars come in and have a more vibrant economy. It's keeping people working, and it's helping people to work, and it's helping people to be self-sufficient. So I see early care and education as dual purpose. One, we're helping kids really grow and develop, and especially the poorest, the importance of learning and give them the greatest chance to be successful in school and life. But we're also helping parents who could not otherwise afford care to be able to afford that, work, and really help the economy. So in many respects, I consider it to be a win-win-win.
Yeah, absolutely. And we have to invest in that. I mean, I was just reading the interesting statistic the other day. 50% of the Chinese students applying for college here have perfect SAT scores. Perfect. That's in math. Wow. That's so. We got to get cracking here. And I think the best level is what you're doing. I mean, the people older, we got to, the flowers for tomorrow. What do you think that families or people with kids, the misconception they have about whether they should seek out help like yours or something like that?
I think the biggest misconception that exists in society is people equate childcare with babysitting, they equate grade school and high school and colleges with education, and I think that's a big misconception that they think you're just basically babysitting and taking care of kids, when in reality a nurturing, stimulating environment, and they actually have a curriculum, and they're doing things that those things are really important. And so the biggest misconception is that real learning and real development isn't really taking place, that it really takes place in grade school and high school and college, when in reality 90% of the brain development, kids who learn how to socialize and develop skills at that age are going to be much more successful in school. So it's kind of educating the public to say, we've made a really big investment in universities and in high schools in our public education system, but we really, as a nation, haven't made that type of investment in early care and education because people haven't always seen the value until you go in and you firsthand experience it and you see it. And as society has changed, we have more and more single moms. We have more and more families that just both people have to work now in order to be able to afford a mortgage and things like that. So as things change, so I think that consciousness needs to develop. That's one of the biggest.
That education has to start at
so.
1 year, not at 5.
Yes. And
if you start at 5, you're behind.
You really are. And that investment is so important at that age. But also, but the struggle is with, as we know, with the economy and dwindling dollars, it's hard to, even if people believe that, it's hard. How do you find and channel money to be able to do that? So there's hard choices for a variety of different people, despite the research and despite the knowledge that's out there.
And then I see, I didn't have kids till I was 40, so my kids are, I was well enough off, and so it wasn't an issue. But I see, I spent a lot of time educating before they went to school, because they had the money and the time and whatever. And if you don't, hey, just you're behind.
I agree, and we also work closely with parents because parents are really the first teachers, and so parents, so
if you don't know how to do it, then.
And so it's really working with the family, and it's working with children, and it's really trying to provide services so that people have enough food and they have a stable environment and they've got quality childcare and they have enough money to be able to put gas in their car and get to work. It's really kind of doing all of those things, especially with the really poor families who are really struggling to make ends meet.
So
but
if you have a child, no matter what age, I mean from 0 to 13, you should check you out. And not only for, depending on income, whether it's financing to pay for services or even help to evaluate your children and find the services and whatever, that you're the portal in the state. How many kids you got in the system?
Well, just in the subsidized child care program, we serve about 130,000 children per month. And that's just our program. That's not including Head Start or PA pre-K counts or just the number of children that are in child care who are not part of the state subsidized child care program.
What do you think that whole universe is?
Oh, that's hundreds of thousands.
Oh, really?
Hundreds of thousands of children either. Like for providers, we have about 8,500 licensed or registered
so you have this little
providers.
Office, you're running all that stuff?
Well, we've got offices in a bunch of different places and different people doing all kinds of different things. And then we have, our grantees who are out in counties, and we have regional offices too. But we run lean and mean and do the best we can with the dollars we have. But no, but the certification inspectors are out in the regions, and they go out and they annually inspect.
Providers. Are you an office to complain about?
Yes. I mean, it depends on what they're going to complain about. They may call the regional office, which does the certification. And certainly, if a complaint comes in, and it will be investigated. If they complain about other types of things, we'll make sure it gets to the right person. So, I mean, one of the big jobs is not only to inspect annually, but if someone calls up and says, hey, something horrible's happened, or these staff-child ratios are out of compliance, or there's something dangerous, a certification inspector will go out depending upon how they'll always go out, but depending upon the seriousness of it, how fast based upon regulation will come in and check that out and make sure that if there is something wrong, it's dealt with. If there's something very serious, you can have your license downgraded, or you can basically lose your license. So that's monitored very closely, because the bottom line is that certification, it's the health and safety of children. That's a minimum, and then on top of that, we want to build quality, and we want to build financing, and we want to build all of those services for them. So we've got
as a daycare provider, I mean, you're more, they fear you more than somebody hiring a lawyer. Well, you can put them out of business.
Well, they could be out of business if they don't meet the rules. I mean, and with the inspections, when they come out, if anything's found, they have to fix that in order to be in full compliance. And there is a set of regulations and rules. And I was a provider for 13 years, so I know how that works. And so it's taken very seriously, because you've got kids in care, and you want to make sure that those minimum health and safety requirements are met. And for those people that are STAR providers, they're also having the licensing inspectors come out, but they also have the STAR manager come out to make sure they're meeting those extra standards that are above and beyond those certification requirements, that the staff has the extra training, has the correct degree level, that the environment is the way it's supposed to be, and they actually do an ERS, an environmental rating system score for STAR 3s and 4s. And so there's a lot of things that you need to do in order to be able to meet those levels and stay there, and you are monitored and you are inspected, and we'll pay a little bit more for higher quality too, which is an incentive in order to get kids there who are there. We have a tiered reimbursement rate for providers to sit there and say,
you have a higher STAR, you get a higher
reimbursement rate. And a tiered rate is for your low income kids as an incentive to be able to do that, and also so that they can continue to maintain that quality. And we very much promote that.
That's reassuring. It's like getting an airplane. I thank God we have government inspecting that airplane's safe when I get them. So if I'm going to give my kids somewhere,
there is a role for government. I mean, but we take that very, we really want to make sure that kids are in healthy and safe environments, but also in high quality environments. So we've really made an effort to push regulated child care and to promote why early care and education is important, why Keystone Stars is important, why PA pre-K counts is important, and really give parents information to make the best choices. And we find out when we do, they do make those best choices for their child.
You got to have the information to decide.
You got to have the information. So we've really made an effort to really do that and really have a good resource and referral system for all families so that they can really see what quality child care looks like and be able to choose that, because everybody wants their child in the best place.
Well, thank you for being here.
You're welcome.
Great stuff.
Thank you.